Hello again. As I told you before, we're going to be talking about what an implant surgery is. And first of all, we need to know and understand there are different types of implant surgeries. Some are complex, some are easier. So what we're going to be talking today is starting with the easiest one. We're going to pretend that we got a bad tooth that is no longer working in your mouth, that needs to be extracted, and we need to replace that tooth. We have different options, but specifically this video is about the surgery. What we need to see first is that all the conditions in your remain bone is still as good to allow an implant. It can be done in two different stages. It will depend if the tooth remain that it's not good no longer, is infected or not. If it's the case that it's infected, there's a big chance or possibility that that area, it needs to be prepared to allow an implant. How is it prepared? It's extracted and it's grafted. That bone graft needs to be at least for 3 months so it can be taken to your own body. After that period of time, the implant, which is the titanium screw, can be placed into your jawbone. After 4 more months that implant is placed, you can have the prosthetic, the actual crown. And then some other cases where that tooth could be not infected and probably you had a trauma, an accident, or it's simply something happened to it, that it could be extracted and the implant be placed at the same time as the extraction along with the bone graft. And any of these two cases is what we define or know as an easy implant surgery. Each implant is dependent on the brands, and by the way, the brands that we use are the best in the world, the number ones that we can work with because we care about the results. Each implant needs to be at least for 4 months until it could be restored, until it could be really functioning in your mouth. By the time that you get with the prosthetic and restorative crown, you're gonna have different options. But I'm gonna really stay here about the surgery. If it's any of the cases, what we can do on any of those surgeries is prepare your body before, so the surgery and the post-operatory can be as easy as possible, or in any other chances or any other cases, we just do the surgery and give you the following medication so it can help your body for healing, to remove infection, and in the end to have the result that we're looking for. On the time of the surgery, it's an open gum surgery most of the times. I will say 95 of the times, because we need to see what we're going to be doing, especially with this only one simple extraction and an implant placement. When your surgery is done, we use sutures. There are two options on the sutures that we can work with. One are dissolvable and the other ones are not dissolvable. We will define the case and which are better for you. We understand different situations about traveling, so we decide what's better work for the patient. The post-operatory, I would say that in any of these two circumstances or examples that I'm talking about, the post-operatory is very predictable. We prepare the patient with antibiotics so it can be attacking any bacteria that could be around before the surgery and protecting it right after. Also with some pain medication and some swelling medication. All of these will take you to the best possible scenario after your surgery. We are going to be expecting some discomfort, which is common after a surgery, and the end of the day is drilling into your bone, so your body will react to it. But it's normal. We know that between the second and third day after the surgery is the major discomfort the patient could possibly feel, but with the medication that we prescribe, all that is settled down to the minimum. Post-operatory, 90–95% of the time on these simple cases is so predictable that we don't have problems with. And we give you in our office more specific instructions of what to eat, what type of food you should have in the next following week, and most important, what not to do and what not to eat or drink. So I really hope all this information is good for you. We try to explain the best possible, but of course, if you have any doubts, you can reach us at any of our websites, of any of our office, or with any of our doctors. It's a pleasure.